needs now, what we need to do in mental health. Ms. Brooks.
I want to thank the gentleman from Pennsylvania, Dr. Murphy, for introducing this important legislation and arranging for this special order today. As I'm sure it's already been stated, 1 in 5 Americans struggle with mental illness. 1 in 5. This is a critical situation in the country, as we've just heard. National tragedy. That's why we must address it with a comprehensive, community-based mental health care proposal like the one we're talking about here today, and we must do it in a bipartisan way. So I'm very pleased that we have colleagues from the other side of the aisle here as well this evening talking about it. We've all seen the tragic headlines about people who lose their battle with mental illness and their families who are often powerless to help them or prevent them from harming themselves or others. According to researchers, about half of the people with schizophrenia and 40% of people with bipolar disorder don't believe they're mentally ill. These individuals have the right to refuse therapy and medication, and under current law, their families are only able to intervene when their condition becomes suicidal or extremely dangerous. So in practical reality, my young adult children in their 20s, if they struggled with serious mental illness, I could be completely shut out from their diagnosis and treatment, unable to help them before their condition became completely debilitating. As a mother, as a parent, this is heartbreaking, and it's further evidence that something has to change. And we've all talked to too many families, whether it is at ceremonies, remembering their lives when they have taken their lives or when they've overdosed. That's too late. This bill is important for all parents in America, the loved ones, the family members who desperately want to help but are unable to do so. But it's also important to every American, regardless of whether or not they have a personal connection to mental illness. It's critically important when we look at our criminal justice system. 60 years ago, and I think we talked about this a little bit earlier, there was 1 psychiatric bed for every 300 Americans. Fast forward 50 years later, that number has shrunk to 1 psychiatric bed for every 3,000 Americans. And today it's even less. And the people, as you've mentioned, the people who work in our emergency rooms and in our criminal justice systems are paying the price. Those people who work there are paying the price as well. The National Alliance on Mental Illness estimates that between 25 and 40% of people with mental illness will be jailed or incarcerated at some time in their lives. I'm a former criminal defense attorney and a prosecutor, so I can tell you, similar, not with respect to treatment, but dealing with them either if they had been arrested or if we needed to prosecute them. I've seen this statistic. These are real people. Our courts, jails, and prisons are full of people with mental illness, and most of them are not getting the treatment they need. In our state prisons and local jails, more than half of the women and 3/4 of the men have at least 1 mental health diagnosis. In federal prisons, about half of all inmates, regardless of gender, struggle with some form of mental illness. So we must reform the way we care for and treat people with mental illness. We can't rely on the prisons and jails to serve as the de facto mental health institutions that they've become, and we must make families the partner to ensure that patients with serious and debilitating illness can maintain a comprehensive regimen of care. So I applaud the work of my colleague, Dr. Murphy, the only psychologist serving in Congress, for his leadership and for crafting the Helping Families in Mental Health Crisis Act, H.R. 2646. I'm not going to go through all of the proposals because you have so many people. I'm so pleased that you have people, because I'm sure you have talked about all that is in the bills. But I must say, I urge my colleagues in joining us in supporting this proposal. It does focus on the programs that will help families and patients. It will improve that connectivity between primary care doctors, mental health professionals, and the patients and families. It will help with the existing shortage of the inpatient psychiatric beds, and it will bring accountability to programs like SAMHSA to make sure that their resources are being used in the most effective and consistent way for patients. And I just want to applaud Dr. Murphy and all of those who care deeply about mental illness, because I don't want to go to more of these ceremonies of family members who are remembering their family members who have died from suicide or have died from overdose.